Hi, today I would like to show you how to use a tool named PhleboAid. This tool will assist you in order to perform blood taking correctly, hence pre-analytical error could be avoided at optimum level. The first step in collecting blood is choosing the appropriate test. The next step is the requester need to fill in the request form completely in order to make sure that the test can be proceeded accordingly depending on the test requested. The mandatory datas needed are name, IC number, gender, age, location, clinical summary, diagnosis, test, date and time of sampling, requester name, signature and stamp. If the person who taking the specimen is different from the requester, please provide the name, signature and the stamp of the phlebotomist as well. Then, tubes are selected according to test requested. Sample requirements differ depending on whether the test request is for virology, serology, clinical biochemistry and/or hematology. The quick guide various applications are listed as below. However, it is recommended to refer to our lab handbook for further details of the test requirement. The next step is, stick the label sticker onto the request form and the specimen tubes accordingly. You must write down the patient's name and full IC number on the label sticker. Please make sure the barcode number, patient's name and IC number is tally between the form and specimen tube. Make sure the sticker was placed vertically and evenly on the tube, and not covering the clear side and level marker on the tube. This will help the lab technician to scan the barcode conveniently. Blood samples must be drawn by phlebotomists in a specific order to avoid cross-contamination of the sample by additives found in different collection tubes. The correct order of draw follows. 1. Blood culture. 2. Sodium citrate tube. 3. Plain tubes. 4. Heparin tube. 5. EDTA tube and 6. Sodium fluoride, potassium oxalate. The most important thing before you start blood taking is to identify patient by asking to identifier and ask for consent. Now you can start collecting blood adequately depending on the test request by doing venipuncture to the patient. After the blood is drawn, fill the collection tubes with the correct volume and following order of draw that I have mentioned in the previous slide. All tubes with additive must be completely filled. Do not change the position of the tube until it is removed from the needle. Do not allow the contents to contact the tube stopper. Make sure the blood is filled in with adequate volume accordingly. The volume indicator is usually shown at the side of the tube sticker label. Immediately mix tubes by gently inverting according to tube specification. If mixing is not thorough, a partial clot may form and could render the specimen unacceptable for use. You can refer to the video how to do proper inversion. One mixing cycle is one inversion involves turning the tube vertically for 180 degrees and putting it back to the starting position. After the blood collection is completed, you can send the specimens to the laboratory immediately to prevent improper storage effect to the specimens and analysis can be done at optimum level. I hope this video can give a clear picture on how to use this PhleboAid correctly and we can achieve zero rejection. Thank you for listening.